is QAM? QAM stands for Quality Assurance Measures. QAM consists of policies and procedures that are developed and maintained by agencies to give staff and volunteers the information to do their jobs. All service agencies in Ontario must follow these rules for the delivery of service for the developmentally challenged demographic. QAM ensures quality support and service to our clients and consumers. The key elements of QAM: promotion of social inclusion, individual choice, independence and rights, individual support plans, finances, health promotion, medical services, and medication, preventing and reporting abuse, confidentiality and privacy, safety in agency-owned and operated places, keeping people safe, human resources practice, service records, and various behavior intervention strategies. Let's break down the key elements of QAM. Promoting social inclusion, individual choice and rights. Supporting people so that they can be part of the community through activities such as volunteering, working, and participating in local sports teams. Agencies must provide support to make sure people with developmental disabilities can be part of the community where they live. Individual support plan. Agencies must have a support plan for every person who uses their services and supports. This should include the following information: goals and expected results, services and supports the person will get from the agency, steps to make sure the person is healthy and safe, whether the person needs help to manage their money, or other community resources that may be available. Helping with day-to-day finances. Sometimes a person with developmental disability needs help managing money. Agencies are to keep a separate record for each person who gets this type of assistance with their finances. The record is to be checked by a third party every year. Health promotion, medical services, and medication. Agencies must have rules about providing public health information to the people they support, nutrition and fitness included. Agencies need to have rules about monitoring the health concerns of people they support, as well as a record of medical services provided. Preventing and reporting abuse. Agencies must have policies and procedures to ensure everyone is safe and no type of abuse or neglect is acceptable. Types of abuse can include physical abuse, neglect, sexual abuse, emotional abuse, verbal abuse, and financial abuse. Policies and procedures must include information about the actions staff would follow in the case of abuse, including calling the police. Confidentiality and privacy. Agencies must have policies and procedures about confidentiality and privacy. This includes collecting, using, or sharing people's personal information. They must follow Ontario privacy laws. Health and safety. Emergency plan, fire safety plan, trained staff, plans for service disruption, equipment must be in working order. Human resources practices. Agencies must have complete reference checks, police record checks for staff, board members, and volunteers. Checks are to happen prior to the individual working alone with any client. All staff and volunteers must be trained on the agency's policies and procedures. Service records. Agencies must keep records on file for all people receiving services and supports for 7 years after the person stops receiving services and support from the agency. Behavior intervention strategies. Some people have developmental disabilities that may cause them to behave in a way where they may hurt themselves, hurt other people, or damage property. Staff need to know how to help a person in these situations. This is called behavior intervention. Strategies related to behavior intervention include behavior support plans. This plan lists how staff should support that person. It also lists the ways agency staff can help them, starting with positive methods, but also could include more intrusive methods, for example, PRN medication. Using intrusive behavior intervention. Intrusive behavior intervention should only be used when a person might hurt themselves or someone else or damage property. Staff must use the least amount of force possible. Residential services and supports. Agencies that provide supports in a residential setting have to meet some extra quality assurance standards. Support the well-being of the person, including such items as provide help to get medical and dental appointments, information on health and nutrition, rules and policies on providing nutritious meals, care of personal property, and pets and service animals. Agencies must also make sure the residence is safe, including all appliances in working order, storing dangerous materials safely, such as cleaning materials or chemicals. Provide comfortable bedrooms with enough space for personal items and private activities. Having a clean and safe recreational and common areas. Maintain comfortable temperatures in the home throughout the year. QAM for Developmental Services Ontario. The final part of the regulation speaks to the rules that Developmental Services Ontario must follow, such as promoting social inclusion, individual choice, and independence, prevent and report abuse, maintain confidentiality and privacy, ensure safety on site, have human resources practices about training and reference checks for people employed, keep service records. Rygiel has a number of policies and procedures to ensure we are in compliance with QAM. These include, but are not limited to, the following: controlled acts, behavior support plan, policies related to personal care and health, policies related to hiring practices such as reference checking and obtaining criminal record check, privacy, abuse and prevention, managing client funds. For more information, please refer to Rygiel Supports for Community Living Policies and Procedures. Rygiel and QAM, our vision. Rygiel promotes social inclusion, individual choice, independence, and rights by adhering to our mission statement, vision, and our beliefs. Our vision: every person we support will have a full and meaningful life, which means having a home and relationships of all kinds, and a variety of socially valued roles. Our mission: Rygiel Supports for Community Living serves people who have a developmental disability and multiple handicaps. The services are determined by a person's individual needs and are designed to enable each person to be a fulfilled, participatory member of the community. Our beliefs: every person has inherent worth and deserves to be respected and treated with dignity. Deserves to live in peace in a safe, secure, and nurturing environment. Is enhanced by relationships with family and with both formal and informal personal networks. Is entitled to have committed allies who will advocate and sometimes act on the individual's behalf. Can contribute in meaningful ways to the life of their community and deserves to be supported by that community. has the right to make decisions, and these decisions should be respected. The person deserves to be assisted and supported in exercising this right. Deserves individualized service, which responds to their changing needs over time. Client rights. People supported are entitled to all the rights set out in the Charter of Rights, and in addition, each person is an individual deserving of respect and equality, has fundamental dignity and value, and needs meaningful opportunities to develop their self-esteem and worth. Each person is a valued member of the community, capable of participating in and contributing to the quality of life and development of that community. Each person should have access to needed services that build on their strengths and capacities as a person. Each person has the right to call on family and friends for support and advocacy throughout their life. Each person has the right to live in an enriching environment. Each person has the right to the necessary supports that provide equal opportunity to live as other members in the community. Example, education, dental, medical, and recreational. Each person is to be respected for their cultural and religious values. Each person has the right to privacy and confidentiality. Orientation requirements. All new staff are required to complete orientation, a general orientation, but also home or day program specific. All staff are required to review all policies, including QAM on hire. As well, there are a number of trainings and reviews that are done annually. Individual support plans. All people supported will have an individual support plan that includes goals, services, supports, health and safety, finances, and level of supervision. Individual support plans will be updated annually. Finances. Rygiel will assist clients that are unable to directly manage their day-to-day finances. All financial records will be reviewed by an independent third party on an annual basis. Each individual will have their own separate bank account and financial records. Health promotion, medical services, and medication. Policies that cover this element include, but are not limited to, Canada Food Guide, Daily Support Guide including safe bathing and showering, sexual education and training, annual medical and dental. Health promotion, medical services, and medication. Policies and training related to staff that cover this element are as follows: CPR first aid training, pharmacology training, NVCI training, controlled acts, specific training to a condition, for example, autism, FASD training, and conscious care. Preventing and reporting abuse. All staff annually must complete the abuse training module. All people supported receive abuse prevention training and reporting when they first begin receiving services, as thereafter, on an annual basis. Rygiel has a no physical restraint policy. Rygiel has a zero tolerance of all forms of abuse. Confidentiality and privacy. All staff must adhere to the confidentiality policy as well as the release of information policy and privacy policy. All employees are to maintain a professional ethical standard regarding all confidential information relating to the people supported, families, and/or fellow employees and agency matters. Safety in agency-owned and operated places. Rygiel currently has an emergency response plan. All staff are trained and it is reviewed annually. Keeping people safe. Rygiel offers a number of trainings for staff in order for them to do their job safely. For example, WMIS, medication training, abuse training, condition-specific training, NVCI, pharmacology training, etc. Human resources practice. All staff must adhere to the HR practices and policies within Rygiel. All new staff attend orientation specific to the home and needs of people supported. All new staff must submit a clear criminal record check, including vulnerable sector. All new staff have had references completed during their recruitment phase. All staff, either new or existing, are required to know the policies and procedures related to their position. All staff are required to attend their annual training. Service records. All records on people supported and/or staff are kept in a safe and secure place. Confidentiality is maintained. Behavior support plans. Rygiel ensures that all people supported with challenging behaviors will have a behavioral support plan in place in order to support them in meeting goals of having independence, more choices, and more inclusion in their community. Any supports or procedures used to achieve behavioral goals will be as non-intrusive as possible and emphasize the development of a supporting environment as well as the promotion of positive behavior and personal safety. For more information on the policies and procedures talked about today, please look at Rygiel Policies and Procedures, Rygiel Health and Safety Policies, Rygiel Human Resource Policies, Rygiel Emergency Plan, Rygiel Annual Training Requirements,